Good evening, everybody, and a very happy Holi to all of you. So, we will wait for a couple of minutes for others to join, and then we'll start with today's session. I hope I'm audible and the slide is also visible. Can anybody please confirm?
Yes, you are clear and video is also clear.
Okay, thank you. Okay, so for anybody who is new to today's class, so I am Sharmishtha Majumdar and I'm a research scholar in IIT Jodhpur, and I'll be taking your problem solving sessions as the PMRF TA for the course Maternal Infant Young Child Nutrition, which is being taken by Dr. Rupal Dalal from IIT Bombay. Okay, so maybe we can start with today's session. So for today's session, I am assuming all of you have already gone through the different lectures that has been put up on the portal for the week 6, and many of you must have already gone through the assignment as well. So today we'll be doing a little recapitulation of the details of the various intricate details of the breastfeeding techniques. So in our previous lectures we have come to know why breastfeeding is important and what is the science of breastfeeding. Like, why are we saying that within the first hour of birth the child should be breastfed, the initiation of breastfeeding? Yeah, so the initiation of breastfeeding should be so early. So now, how to do the breastfeeding? So it has been seen that many women, many people among us, they do not have the proper information as to what the specific breastfeeding techniques are, and that directly impacts the health of the child, that directly impacts the growth and development of the child. So we will be going through the different specifications of these breastfeeding techniques through different problems. So we'll move on to our first problem. Which of the following is not an early hunger signal of a baby? Opening of eyes, looking around, squirming, searching for breast. So the question says, which of the following is not an early hunger signal of a baby? Anybody would like to volunteer?
Is C?
Yes. Anybody else? Please volunteer.
Searching for the best.
Okay.
D.
Okay. So now we have got two answers, right? Once. Yes.
C.
Okay. Okay. So let's see what is the correct answer and why are we saying. So the correct answer is squirming. So let's see. When we are talking about the different hunger signals of a baby, so here we are talking about the hunger cues, and there are specific hunger cues which have been categorized as to early hunger cues, middle hunger cues, and late hunger cues, right? So if we look at the different options that has been given to us, opening of eyes, looking around, squirming, and searching for breast. So all these movements and all these activities that the baby does, say for example, opening of the eyes and then looking around, moving around, and the instinct of that baby to search for the breast so that it can go and breastfeed, and reaching for the breast and then showing that yes, I am hungry, like salivating and putting the hands in his or her mouth. So these are all early hunger cues. So these are early hunger signs or signals that a baby shows that yes, I am now hungry, so I need the food. Now coming on to the subsequent hunger signals. So now if the baby doesn't get the food, so the baby becomes a little bit agitated. So because of this, now the baby starts becoming agitated. The baby shows different kinds of movement and also shows squirming. So squirming is an intermediate kind of hunger signal. And now If it has been a long time that the baby has not been given the food and the baby is very hungry, then it shows the late hunger cues. The most significant of it is crying. So the baby will become very agitated, very irritated, and then the baby will cry. It might happen that the baby will turn red, and so these are the very characteristic, very specific signals that show that the baby is hungry. And this is why it is important for a mother to specifically identify that these are the signals and accordingly breastfeed the child. So for this question, the answer is squirming. Okay. Any doubts related to the last question? No, right?
No, ma'am. No. Thank you.
So we'll move on to our next question. The next question says, in sitting position of the baby to make him burp, where should the mother place her fingers for support? So in sitting position of the baby to make him burp, where should the mother place her fingers for support? So what do you think would be the answer?
It's D, on the jaw.
A around the neck.
Okay.
On the jaw.
Okay. Okay. So let us see the answer first, then we'll discuss. So the answer to this question is on the jaws. So we have to be very critical of the position that we are talking about. So in this position, say for suppose we are trying to wake up a baby, or we are trying to make the baby burp. So in these cases, we are putting the baby in such a sitting position where the mother supports the baby, putting the hands on both the sides of the jaw or of the lower jaw or the mandible. So here, as we can see, the options given: around the neck, on the head, around the forehead, on the jaws. So as we can say, on the head and around the forehead doesn't make sense. Obviously, that wouldn't give the proper support that the baby requires, right? So since the class has been divided into the around the neck and the on the jaws option, so let us see why we wouldn't place our hands, or where the mother wouldn't place the hands for support on the neck. So the baby's neck, for suppose if we are putting the hands for support on the jaw, and in a similar way if the hands are put on the neck, so there are chances of impinging the arteries. So as we know that our carotid arteries are here in the neck, which is a major artery, so there might be possibilities of harming that. So women who are not adequately informed about the placement of the arteries, or how much pressure can be given, or what is the specific placement of their hands, so these might lead to an impact on the arterial circulation. So because of this, it is advocated that the hand should be the head of the baby should be supported by keeping the hands on the jaws, on the lower jaws. So the answer for this question is on the jaws. Okay, so let us move on to the next question. So the next question says, how many times should the mother breastfeed the baby at night?
3-4 times.
D, 3 to 4 times.
D 3 to 4 times.
Okay, so everybody unanimously wants to answer 3 to 4 times.
3 to 4 times.
Okay, so we have the answer very correctly. All of you have said it is 3 to 4 times. So it is very important to have a proper so it is very important to have a proper note as to how much or how many times the baby needs to be fed. And there are a lot of mothers who are not informed about the specifications or the number of times they should be fed. Ideally, it is according to the demand. But then also there should be a specific count as to how they could be guided, that these are the number of times that the baby should be fed. So if we consider in a total of 24 hours of the day, so the baby should be fed around 10 to 12 times. So we have learned it in our previous sessions also. So in a period of 24 hours, the baby should be breastfed for at least 10 to 12 times. And specifically, if we consider the night time, then it is best if the baby is fed for around 3 to 4 times. So please keep these numbers in mind for the for of course the assignment and the examination point of view, but of course it might come handy also when we are trying to help somebody else. So these things will be helpful, so please keep these things in mind. So let us move on to the next question. What are the initial steps the mother should take before breastfeeding the baby? What are the initial steps the mother should take before breastfeeding the baby? Anybody
D.
would like to
D.
volunteer?
D. D.
Okay.
Wash hands with soap and warm water followed by drinking a glass of water.
Okay. So yes, the correct answer is D. And of course, we all know that before breastfeeding the child, the mother can be doing any kind of work, and it is imperative that she sanitizes or cleans her hand. So, of course, washing hands with soap and warm water. And many a times the mother forgets to take care of her own body, of her own health when it comes to feeding the child. So because of this, these two steps are very important before moving on to feeding the child. So one is cleaning her hands with soap and warm water, and number two is having a glass of water before the entire procedure. So she is advocated to have at least 250 ml to 300 ml of water. It is best if the water is boiled. If mothers living in urban areas or mothers who can afford filtered water or clean water, then nothing like it. But we have a lot of our mothers living in rural areas. So best would be to advocate them to boil their water and then cool them down at room temperature, and then before feeding the child to have this water, at least 250 ml or 300 ml. So this would help our mothers to get relaxed and also hydrate them. So these two steps are very important. Unless and until they take care of themselves, they will not be able to take care of their babies. So it is very important that they keep in mind their well-being as well. So hence these two steps before initiation of breastfeeding is very important during the preparatory phase. So yes, somebody has raised a hand.
Yes, ma'am. And one more thing, when mother will drink warm water, she will feel relaxed and release oxytocin
Yes,
hormone.
yes,
Which
absolutely.
helps.
You're
Yes.
absolutely correct. So whenever the mother is feeling relaxed, so that will definitely, as we have discussed this in the previous session, how the oxytocin cycle is happening in her body. So this oxytocin, which is also known as a love hormone. So because of this, there's a sense of satisfaction in the body or in the individual, say in the mother in this case. So because of this, what will happen, the signal, it directly goes to the brain, and the brain says that okay, you can express more milk. So because of the oxytocin mechanism as well, because of the Mr. Odhikari, could you please mute
Yeah,
yourself?
yes. Yeah. Yeah, yeah.
Yeah, thank you. Thank you. Yes. So, as Mrs. Kaushalla has very rightly said, that it also releases oxytocin, and because of this, there is more expression of milk. So, very, very correctly said. Thank you. So, we'll move on to our next question. In a cradle hold position, how are the baby's legs supported? In a cradle hold position, how are the baby's legs supported? Anybody would like to volunteer?
The baby's legs are shoved in mother's arms.
Okay. Anybody else?
It's B. Is it B's legs are tucked in mother's arms.
Okay. Okay. Let us read the question again. In a cradle hold position, how are the baby's legs supported? So the question says cradle hold. It is one of the most traditional position which is being used for breastfeeding. So what we were learning about is cross cradle position, right? So in cradle hold, what happens? The same hand is used as the breast, so the same direction. And in the cross cradle, what happens? It is the opposite. So it is the left hand which is being supporting the baby if the baby is supposed to be fed from the right breast. So what happens? Say for suppose if we say when the baby is kept in a cradle position. So cradle position, if the baby is supposed to be fed with the right breast, so the right hand is being used. And because of this, what happens? Many a times the legs of the babies, it remains unsupported. So what happens, as we know, as we have gone through the lectures, we know that in a cross, so in a cross cradle hold position, since it is a opposite position in opposite placement, so it is possible to tuck in the legs of the baby in the armpit area and then lock it with the mother's elbow. So it is secured in that way. But in case of a cradle position, what happens? Sometimes, since the mother has to also mediate the movements of her breast or check the different activities that are happening with her opposite hand, so because of the involvement of both the hands, sometimes what happens? The legs of the baby, they remain unsupported. So this is one of a very, yeah. So yes. So Dr. Patel says A. Mother's baby's legs are kept on mother's belly.
No, sorry, it is a B answer. Sorry.
Okay. So yes, so I was explaining that only. The question says cradle hold position. So this in cradle hold position as compared to cross cradle hold, it is a very common occurrence where the legs might be unsupported. So as I've just explained, that in cross cradle we have an opposite placement, right? And in cradle hold we have the same placement. So because of it, many mothers, they are unable to provide the specific locking or the specific support which is required with their hands, since in cradle hold many a times both the hands are occupied. So with one hand the mother is already holding the baby, and with other hand she has to mediate the different movements of the breast or the activities of the breast. So because of this, the legs remain unsupported. So please keep in mind the disadvantages of a cradle hold position as compared to a cross cradle hold. So the answer to this question is the baby's legs might become unsupported. So please go through the disadvantages of a cradle hold position and subsequently the advantages of a cross cradle hold. And I am sure this will help you to understand the specifications of both the techniques. So as we know, the cradle hold is a more traditional one, but because of these disadvantages, the cross cradle hold has been advocated to a more advantageous and a more beneficial technique for breastfeeding. So I hope I am clear regarding this.
Yeah, yes, ma'am. Thank you. Thank you.
Okay, so we'll move on to the next question. What is the ideal position for a baby during breastfeeding? What is the ideal position for a baby during breastfeeding?
A, eyes, neck and shoulder in same line. B, ear, shoulder and hip joint in the same line.
B. Answer is B, madam.
B.
B. Ear, shoulder, and hip joint in the same line.
Okay. So as most of you have very correctly pointed out, the ideal position for the baby during breastfeeding is ears, shoulder, and hip joint should be in the same line. So, as we have seen in the lectures, that the child, when is held in a cross cradle hold position, so the ears, it shouldn't be that the head of the child is facing outside or facing more towards inside, because of which the angulation of the ear becomes different from the plane at which the shoulder and the hip joint is situated. So it is very important that the ear, the shoulders, and the hip joint of the baby should be in a straight line, so that it helps the baby to swallow effectively and also place its mouth effectively. So let us look at the options. So yes, we know the correct answer. Ears, shoulders, and hip joint should be at the same plane or in the same line. So eyes, neck, and shoulders in same line, of course, no, doesn't make sense. Ears, shoulders, and hip joint in same line. Any position that the baby is held in. Obviously, this is not true. The mother can hold, if a mother is not properly informed, or if a mother is I don't know whether I can use the word novice or not, but yes, if she is not properly informed as to how she should hold the baby, then in any position that the baby is held, of course, that won't be giving the proper benefits of the breastfeeding that the mother or the child are looking forward to. So of course, this option also stands incorrect. A diagonal position to the mother's chest. So just in the previous question, we have discussed about the cradle hold. So many a times what happens, since we are using the same hand to the same breast placement in the cradle hold, so the baby becomes diagonal to the body of the mother. So this placement is also disadvantageous. So it might happen that the baby is in a straight plane, but then this diagonal position might be very uncomfortable for the baby to swallow eventually. So these things should also be kept in mind regarding the specific or the ideal position of the baby during breastfeeding. So let us move on to the next question. If the lips of the child are in horizontal position, what should be the ideal position of the mother's fingers on her breast for proper latching? So the options are vertical, over the upper areola, horizontal, and on the nipple.
Horizontal.
Okay. Anybody else?
Horizontal, C.
Okay. Okay. So if the lips of the child are in horizontal position, ideally the mother's fingers on her breast should also be at a horizontal angulation for proper latching. So as a thumb rule, it should always be remembered that the placement of the mother's fingers on her breast should be parallel to the baby's lips. So in the cross cradle position, like we know that the baby's lips are vertical. So of course, if the baby's lips are vertical, so then the placement of the mother's fingers on her breast for proper latching should also be in a vertical position. So as the question talks about a horizontal position, so though the horizontal position might be a disadvantageous position, but still for the matter of the question, the answer should be horizontal. So if the lips of the child are in horizontal position, then the placement of the mother's fingers should also be horizontal, as the placement should be ideally parallel. So the correct answer is horizontal. Okay. So we'll move on to the next question. What will a 2 o'clock, 10 o'clock finger positioning result into? What will a 2 o'clock, 10 o'clock finger positioning result into? Anybody would like to volunteer for the answer?
Nipple feeding.
Okay.
Is it D? Baby's
D,
mouth and
baby's mouth in lower areolar region.
Okay. So,
Looks like C, nipple feeding.
okay. So why do you say it's nipple feeding?
Because when we are holding the breast at 2 o'clock and 10 o'clock position, so what happens? The palm area covers maximum of the breast, you know. So at that time, baby is not able to get better spacing to grab the lower areola properly. That is why I feel it ends up coming closer to the nipple.
I think finger position should be at 3 o'clock and 9 o'clock position. So the correctly that nipple plus lower areola will go in the mouth. But when it is used like this, definitely the nipple feeding only happens.
Correct. Very correct. So as we can see in the options, ideal cupping of breast. So as we know, for an ideal cupping of breast, what we are talking about is the proper breast positioning, or the contouring of the breast. So for the proper cupping, ideal cupping, so it should be in a position of 3 o'clock and 9 o'clock. So as very rightly said by Dr. Patel, it should be a 3 o'clock and 9 o'clock position, and ideally the cupping should be from the underneath. It should be from the downward position, so that it is easier for the mother to observe the position and the situation at which the baby's lips are, right? So the ideal cupping of breast should be in a 3 o'clock 9 o'clock. So it is, if we consider the whole areolar region as a clock, so the fingers should be placed at a 3 o'clock and 6 o'clock 9 o'clock position, and the lower trough should be at a 6 o'clock position. So this is a proper positioning of the fingers. Now if there is a 2 o'clock and a 10 o'clock, so if, say for suppose, the fingers are rested, if we do it from the downward, and if it is put at a 2 o'clock and 10 o'clock position, so that leads to an improper positioning of the fingers of the mother. So obviously because of that, the child will not be able to put his or her mouth onto the lower part of the areola or the lower areola, right? So this will lead to nipple feeding and hence improper latching. So as we can see, ideal cupping of breast, definitely not, because that is done by the 3 o'clock and the 9 o'clock positioning. Proper latching, no, this will lead to improper latching. Nipple feeding, yes. And baby's mouth in lower areolar region, we know that if the lips are properly positioned at the lower part of the lower areolar region, so that is desired. So definitely C is the correct answer. So let's move on to the next question. Preferred direction of hand placement during breast contouring in cross cradle hold is? Anybody? Okay. I have just given out the answer in the last discussion. So I would like somebody to please tell me aloud the answer. I hope everybody is awake, right?
From underneath, no?
Yes.
To make in a U thing, and
Yes.
then same 3 and 9 o'clock, and down that curve should come
At the
down.
6 o'clock, correct.
6
So
o'clock.
as I have just discussed even in the last question, so when we are trying to maintain the 3 o'clock and the 9 o'clock position and the U hold, so this should be a characteristic U hold, and this should be from the downward direction. So if it's beneath, if it's from underneath the breast, so obviously it is easier for the mother to visualize, because after latching the breast onto the baby's mouth, it is also very important for the mother to inspect as to whether the lips have been properly latched or not. So that visualization is easier if the cupping of the breast is from the lower side or underneath. So the answer to this question is underneath. So the preferred direction of hand placement during breast contouring in cross cradle hold is from the underneath direction. So it is a U-shaped hold from underneath, as we have mentioned, 3 o'clock, 9 o'clock position, and the dip of the U shape should be at a 6 o'clock position. And many a times what happens, this dip doesn't come into the 6 o'clock position. So because of that, it is advisable that the mother is told to keep her shoulders relaxed. So if the shoulders are relaxed, so then the hands will be relaxed and it will be easier for her to maintain that position. It shouldn't happen that the mother is tensed or the mother's shoulders are not relaxed or kept in some other position. So the shoulders should be very much relaxed to eventually get the proper positioning of the hands also during breast contouring. So the answer for this is from underneath. So let's move on to the next question. When will we not observe baby dimple during breastfeeding?
See, lower lip, the lower border of eye.
Okay. Sorry. Anybody else would like to volunteer? Okay.
See, madam, lower lip at the lower border of
C.
the ring.
Okay. So I have the same group of people answering in all the classes. I hope the other people are not sleeping, right? I would like to hear others also answer. So, okay, let us go with this question's answer. So, the answer is lower lip at the lower border of areola. So, as we know, whenever the breastfeeding is in process, so many a times there is a phenomenon which happens known as the dimpling. So, this dimple which is being seen in the babies, like the occurrence of a dimple on the cheeks of the baby, so that means the baby is trying hard to get the milk or the baby is trying hard to suck. So because of this, there is a dimpling effect on the cheeks of the baby. So this might be because of if there is improper latching. So if the baby's mouth has been improperly latched onto the upper areolar part. So whenever we are talking about a proper latching position, so it is always the lower part of the areola, the entire areola with the nipple, and the lower part of the areola which needs to be inside the mouth of the baby. So the upper areola is definitely not the desired site which needs to be latched onto. So obviously, number one, in option A, we will be observing dimples. Second, nipple feeding. So nipple feeding is also an undesired mechanism or an undesired way of breastfeeding. So that is also incorrect latching. So in that case also we might be looking, we might be observing dimples. Then lower lip at the lower border of areola. So it is a proper positioning of the baby's lips. So if there is proper positioning of the baby's lips, of the lower lip at the lower border of the areola, so because of this, the baby's mouth is stabilized, and so there is proper sucking which is being happening inside, proper sucking which is maintaining the air balance also inside the baby's mouth. So because of this, there is no dimple formation in the baby's mouth. D, baby too far away from the areola. So if the baby is too far away from the areola, the baby is not being able to latch onto it properly, and this might also lead to the formation of dimples. So as you people have very correctly said, the answer to this question is lower lip at the lower border of areola. So please remember the specific positions of the proper breastfeeding, the proper latching. So as to what would be the specific characteristics. Say for suppose if we are talking about proper latching, so the lips should also be uh, protruded outside, so it should be curved outward. So that is also one characteristic of proper latching. We have discussed this in our previous sessions as well. So the chin should also be in contact with the mother's breast. So these positions, these are very important so that there is proper latching, and that also ensures that there will be comfort for both the child as well as for the mother. So let us move on to the next question. What position of mother's shoulders will not lead to improper breastfeeding? What position of mother's shoulders will not lead to improper breastfeeding? Anybody with the answer? You can write in the chat boxes also if you don't feel like.
Is it elevated shoulders?
Okay. Anybody else would like to volunteer? Okay.
It's a D, madam. Shoulders close to the trunk.
Okay. Anybody else? Any more answers? Okay. So let us look at the question. So the question says, what position of mother's shoulders will not lead to improper breastfeeding? Will not lead to improper breastfeeding, right? So please read the question very carefully. So we have the options: elevated shoulders, curved shoulders, shoulders bent forward, and shoulders close to trunk. So I have just mentioned couple of minutes ago that if the mother's shoulders are not relaxed, so there would be an improper way the mother would be cupping her breast for further breastfeeding process, right? So if the mother has got elevated shoulders, so if the mother is having an elevated shoulder or having a curved shoulder, or simply if she's bending forward, so because of all these positions or all these placements of her shoulders, so that shows that she's not in a relaxed position. So her body is not in a relaxed position. So this will definitely impact her ultimate posture as to when she will breastfeed the child. So because of this, the shoulders need to be relaxed, and also how much possible the hands need to be close to the trunk of the body. So it should be close to the body. So this is a relaxed way where the hands are closer to the body and her shoulders are relaxed and close to the trunk, and this will ensure that she is able to provide the specific kind of support that is required while breastfeeding the baby. So be it the proper placement of her fingers, or be it the proper cupping procedure, or say an additional support that she can instinctively give during breastfeeding. So all this can be all this can be expedited if her body posture is very much relaxed. So obviously the answer to this question is shoulders close to trunk. So technically the option sounds a bit weird, shoulders close to trunk, but it definitely means that the shoulders are relaxed and the hands are closer to trunk. So yeah, so the answer is option D. I hope I'm clear, and the answer is not elevated shoulders. So if it is elevated shoulders, then of course there it is not a relaxed state of the body, right? So it is not option any other options. Is it fine?
Yes, ma'am.
Sure, thank
Okay. So we'll move on to our next question. A mother feeds the baby religiously but never inspects for remaining milk in her breast. The baby has not been showing improvement in growth. What could be the possible reason? So these
D.
yes.
D.
B for B for Bombay or D for Delhi?
D for Delhi.
Okay. Okay.
It's D. She feeds him milk to the baby.
Okay.
Ma'am, C. C is the option.
Okay.
Option C. She feeds milk to the baby.
Yes.
Yes.
So I would request you people to please read the question carefully. So it says, a mother feeds the baby religiously but never inspects for the remaining milk in her breast. So this might be a very common occurrence in a lot of Indian households where the mother is definitely very caring and she cares for her baby religiously, but it's not, but she is not informed whether she needs to inspect for the remaining amount of milk in her breast or not. So she might be continuously feeding her
Actually,
baby.
this is a confusing question. You know what? Option C also might be one of the reasons. Option B also is possible. Because without knowing, if the baby is actually feeling full or not, if the baby is cluster feeding all the time, she will, as a mother, she'll only say that the baby is sucking and she will want to keep offering the baby.
Yes.
So this is a very thin line of confusion here.
Yes, it is a, as you said, there is a thin line of confusion here. But then again, the question also has never inspects for remaining milk in her breast. So that is an indication for the answer here. So the mother, say for suppose, if you go through the options, it is she practices alternate feeding, she practices cluster feeding, she feeds foremilk to the baby, and she feeds hind milk to the baby. So she never inspects uh, as to how much milk is remaining in her breast, and irrespective of that, she keeps on feeding the baby, and then the baby is not showing improvement in growth. So this is an indication to the answer that she feeds formilk to the baby. So as we have discussed in our previous sessions as well, that foremilk is the watery milk, right? So the foremilk will have carbohydrate and proteins, but it is the hind milk which is actually responsible for the improvement or the growth and development, as it is having fats, right? So the hind milk, it has fat which is necessary for the growth and development of the baby's brain, and then improvement of different sense organs like eyes, and also it is very much beneficial for brain, sorry, heart. So these things are being mediated by the fat which is being present in the hind milk. So what, as if we go through the question, so it asks about what could be a possible reason. So the possible reason should be she feeds foremilk to the baby, right? And ideally it should be that she should also feed the hind milk where the fats are present, but since she never inspects for the amount of milk which is being remaining in her breast, so because of that, it might be possible that she keeps on feeding her baby, but since the specific type of milk is not being fed to the baby, so because of that, the growth is not occurring as per expected. So I think, am I clear, or is there any
Yes, very, very, very clear. Thank you so much.
okay. Okay. So the answer is foremilk, right? So can anybody also tell me what are the fats which are there in the hind milk, specifically in the hind milk? We are saying that
Fat,
the, yes,
fat and some part of this protein also there.
yes, some part, it's majorly fat. It's the hind milk is majorly fat, and it also contains different proteins as well. But my question is, what are the fats which are specifically present in the hind milk? Why do we stress on the fact that the child should be given the hind milk? I mean, why is it so important?
So omega-3 fats,
Hmm? Yes, you are very
More
correct.
fat, more
Yes.
fat.
Yes, definitely. More fat is present in the hind milk, and as you have just mentioned, the omega-3 fats. So, in the different lectures we have had of the previous weeks, we have gone through that these omega-3 fats are very important for our nutrition, right? So, these omega-3 fats, for example, there are two specific omega-3 fats which are present in breast milk. We have gone through these questions as well. Can anybody help me out with the answer? Anybody? Okay, so maybe I'll give you a hint. So DHA is one of the omega-3 fatty acids which is present in the milk, in the breast milk. Which is the other one? Did anybody write anything? Okay. Okay, so we have discussed this in our previous sessions as well. Please go back and have a look at it. So, whenever we are talking about fats, good fats, okay, okay. So, you have correctly said the name of an omega 3 fatty acid, but this is not present in the hind milk, right? So, alpha linolenic acid is an omega 3 fatty acid, very correct. But when we are considering the hind milk or the breast milk in general, so the fatty acids or the omega 3 fats or the good fats which are present in breast milk, these are the DHA and the EPA. So DHA and EPA, please remember, these are very important and they have very beneficial effects on the baby's brain, heart and eyes. So these two good fats are present in the hind milk. So it is advocated that whenever the mother is feeding the baby, so the entire milk should be fed. It is not that since the fore milk is very watery, so if the baby feeds only on the fore milk, then the specific nutrition which is being obtained from the hind milk, it will not reach the baby. And if that doesn't reach the baby, then of course the more significant brain development, heart development and beneficial for the eye, so all these things will not be occurring in the early stages of the baby's growth. So hence, hind milk is very important during breastfeeding. So please go through the previous sessions as well. We have discussed these as well. So we will move on to our next question. What is the correct sequence for inspecting the presence of remnant hind milk in the breast?
C, PCR, press,
Okay.
compress, and release.
Okay, correct, very correct. So, excuse me. So, the correct sequence for inspecting the presence of remnant hind milk in the breast is PCR: press, compress, and release. So, we have been discussing about excuse me. So we have been discussing about the importance of the hind milk that needs to be given to the baby, right? So to properly investigate as to whether the milk, how much, not how much, or whether the what milk is remaining in the breast, so the proper sequence for investigating that would be press. The movement sequence should be press, where the mother should press her breast tissue against the chest wall and then compress. With her fingers, she should compress her breast and then release. So, this release will lead to the release of the kind of milk which is remaining in the breast, right? So either we can get some milk which is watery in consistency, or we can get milk which is thick, right? So based on what kind of consistency of milk is being released, we can come to the conclusion that whether the fore milk is remaining or the hind milk is remaining, or what is the status of the milk which is remaining in the breast. And accordingly, the mother can, yeah, and accordingly the mother can take the decision, or rather the mother can make the decision whether the child needs to be shifted to the other breast or not, right? So whether what kind of milk is being remaining in the breast, so based on that the mother will decide whether she can keep on feeding the baby from the same breast or move the baby to the other breast. So the answer to this question is PCR, press, compress and release. So we move on to our next question. A mother notices a spray of watery milk when expressed while breastfeeding. What should she do? We have been discussing this for the last 10 minutes, I am supposing. So,
It's a B, ma'am. Continuous feeding from the same breast.
okay. Anybody else with the answer? Right. So, you people have very correctly said that it is continue feeding from the same breast. So, we have been discussing this. If, like, as I said, that we have to, yes, the correct answer is B. Correct. So, as we just discussed in the last question, the proper sequence would be press, compress, and release. So now when the milk is being released, if we see that a lot of watery milk is coming in amount, so that means obviously the foremilk, it's the foremilk which is coming out of the breast, right? So the mother needs to be feeding, needs to keep feeding the baby from the same breast. It might happen that when the breast is when the milk is expressed, so there is a jet or there is a spray of thicker milk. So this thicker milk means it is hind milk, right? So if we see a spray of hind milk coming, we can assume that there is still a considerable amount of hind milk which remains in the breast, and the baby can be fed from the same breast, right? Now, if we see that there are few drops which are coming out, yeah. So now if we see there are very few drops of thick milk which are coming out from the breast when expressed, so this means that the hind milk has also been consumed by the baby, and there is very little amount of hind milk which is left in the breast, right? So then, as we just discussed, the mother can take the decision that whether, if the baby has been done with the consumption, with the feeding, then obviously the cycle can get terminated there, or she can transfer the baby to the other breast, right? So regarding this, so regarding this, if I remember correctly, somebody had posted a question. Somebody had posted a query. So I think it's question number 16 in your assignment.
And 6, madam, don't both 6 and 16.
Okay. I think number 16 was related to this, right? I can't remember the questions though. I think it was question number 16. Yes. So if you go through the question, you will see that there are options which says 3 drops of thick milk and 5 drops of thick milk. So please do not get confused with the options. Just read it carefully, and it is an exclusion MCQ. So if you exclude those 3 options, you can easily say that this is the answer. There is nothing to be confused. Please remember that if there is...
But there are 5 drops also there, ma'am. So
yes.
5 drops and 3 drops.
Yes. Can you read the question, please? Is it possible for you to read the question? Will you be able to? Or...
Yes. Let me read.
Okay. Maybe we can take it at the end of the class also.
Yeah.
Yeah. So you can just go through the question.
Ma'am, just a quick doubt. Sorry.
Yes, please.
Just a quick doubt.
Yes.
Do we get to access this recording?
Sorry, can you come again?
Do we get the access for these recordings to just revise before the exams?
Yes, absolutely. As I have mentioned in the last class also, so you will be, you have already been shared the sheet where we upload the links of these recordings. So these recordings of every week, they are already being uploaded on YouTube, and you must have received an email from the NPTEL team regarding the problem solving sessions, right? And
Okay, yeah, right.
yeah, and if you go to that link, you can see wherever you find your assignments, there is a tab where there is problem solving session written.
Okay.
I think I have discussed this in the last session also, but let me.
Sorry, I think
No, no,
I
that's
just
fine. I'll just
missed
clarify
that
it for you.
discussion.
So,
Ma'am, I got the question.
yeah,
Sorry.
just give me 1 minute. We'll come back
Yeah.
to the question.
Yeah.
So, if you click on the problem solving session, you will find a click here command. So, if you go to that, there is an Excel sheet, and in the Excel sheet, you will find the links to all these recordings and also the slides
Okay.
that we show to you people. So there is
Okay,
you can
okay.
easily access all these matter that is being discussed in the problem solving sessions.
Thank you. Because here I'm actually outside in a, village, but
Okay,
the signal is going
No,
haywire here.
just follow the mails
That
that
is
you
right.
get from NPTEL. Follow it,
Yeah.
and that has already been
Ah.
shared. So there is you need not worry. It has already been shared, and every week that we are having these sessions, we keep on adding it. So these
Okay.
recorded sessions are already there on YouTube.
Okay.
Okay.
Yeah. Thank you.
Yes. Okay, Mr. Vemula, coming back to your question.
Yeah.
Yeah.
Can I read that question,
Yes,
ma'am?
yes, absolutely. You can read it or you
Yeah.
can paste it in the chat box also, whatever is convenient.
Okay. I will just copy it and just
Yeah.
pasting it.
Okay.
Yes, ma'am. This is the question.
Okay. So the question is, how will the mother know if she should continue feeding the baby from the same breast? Right?
Yes, ma'am. Yes.
So the question it relates, the question is regarding feeding from the same breast. Sorry. You read the options. So if thin watery milk comes out from the breast, or if there is a good flow of thick milk on expression. So that means thin watery milk is coming, that means there is still foremilk, right? It is still the foremilk which is flowing. Or good flow of thick milk on expression, that is the good flow of hind milk. This is option number 1. If 5 drops of thick milk come out on expression, if no milk comes out during expression, and if 3 drops of thick milk come out during expression. So all the last 3 options, as they are coming out in drops or no milk, so that means that the hind milk is almost over. So if the hind milk is almost over, that means this is the correct situation in which the baby needs to be transferred to the other breast. Since your question talks about the same breast, so your answer is option A. I hope I am clear.
Yeah, good. Got it, madam. Thank you.
Okay.
Yes, ma'am. Thank you.
So we'll move on to our next question. What is the ideal time to sensitize mothers about breastfeeding techniques and practicing them?
D.
D. Okay.
D.
Correct. So as most of you have very rightly said, it is the 3rd trimester. So yes, many of you have written B. Definitely it can be, the earlier it is started, it is better. But then the ideal time, if we talk about the ideal time to sensitize mothers, the answer is 3rd trimester. So, as the question also asks about practicing the breastfeeding techniques, so it is more beneficial when the mother is in 3rd trimester. So definitely it is not after the delivery that the mother should be informed about the breastfeeding techniques and the advantages of the breastfeeding techniques, but obviously before delivery, and more specifically during the third trimester, when she should be informed about the techniques, about the proper specifications related to the techniques, and also maybe through models she should be motivated to practice them as well. So the answer to this question is third trimester. We will move on to our next question. Breastfeeding positions can vary and change depending on an infant's size, gestational age and abilities, maternal body shape, breast size and shape, recent procedures, and mother's preference. Anybody with the answer? Is it true or false? So, do these parameters influence the breastfeeding positions or not?
No, madam.
Okay.
It is false.
Okay. Anybody else? Let us look at the answer. So the answer is true. So the question asks,
True.
breastfeeding positions can vary, right? So definitely the breastfeeding positions can vary, keeping in mind the principles are the same. As we have discussed, the specific placements, as we have discussed, say for example in the cross cradle hold, how the baby should be held, what should be the specific plane in which the baby's in which the baby should be held. Say for suppose the ear, shoulder and hips should be straight, or how, where is the exact position that the baby, the mother's fingers should be supporting the baby's head or the neck or the back of the baby, and also how the legs should be supported. So all these principles should be the same, and also what should be the position of the neck, whether it should be a little bit tilted, and what should be the position of the mouth of the baby so that there is proper latching. So all these are specific factors which are to be maintained. But definitely if we have say for suppose if we have obese mothers, or if we have a malnourished mother, or say suppose we have different body shapes and the different breast shapes also. So because of that, or maybe say the mother might be having specific preferences, so because of that the breastfeeding positions can be altered. And also it is a given fact that a breastfeeding position, keeping in mind that these principles are maintained, any position that is comfortable for the mother as well as for the baby, it is a proper breastfeeding positions. But definitely keeping in mind that the baby should be properly held, the baby's mouth should be properly positioned. So this answer should be true, since we are also talking about the mother's body shape, the breast size and shape, and also the gestational age and abilities. So based on the question, the answer is true. We'll move on to the next question. If the breastfeeding parent wishes to remove the latched on baby, the parent can break the suction by: number one, gently inserting a clean finger into the corner of the infant's mouth and in between the gums. Number two, pulling the nipple out of the infant's mouth while latched. Number three, gently pull down on the infant's chin to unlatch. So what do you think would be the answer?
Ma'am, D. 1, 3.
Right.
Ma'am, D,
1 and 3.
Yes.
Option D.
Yes, correct.
Option
So,
D.
correct. So all of you have very correctly said. So if we need to remove a latched on baby, so the safest way and the proper way would be to insert. Yes. So option is the correct option is D. So the proper way would be to insert the mother's clean finger into the infant's corner of the mouth or in between the gums, so that it can be easily opened and then the unlatching can be done. Obviously, the second option, pulling out the nipple out of the infant's mouth while latched, it is absolutely not desirable because that can cause an injury to the mother's breast, and it can be a very as a very it can be discomfort to the mother. So definitely it is not desirable. And also gently pull down on the infant's chin to unlatch. So either you insert your finger and you slowly, yes, anybody is trying to say something? Okay. So either the mother needs to put her finger and slowly try to move the baby's lips from the breast, or she can even pull down the infant's chin so that the lips can get detached from the breast. So the answer to this question is option D, 1 and 3. So definitely there might be a lot of mothers around us. It might be because of different causes. They might feel that okay, we can just pull out our the nipple from the from the baby's mouth, and they should also be informed that this is a very improper way to do the unlatching. So that might be more disadvantageous to the mother, because that will be it will not be comfortable for the mother, and this would be a problem more on the mother's side. So these kind of education and motivation should be given to the mothers also, so that the proper techniques can be followed related to breastfeeding. So we'll move on to our next question. Baby-led latching is a laid-back position that is helpful when the infant is learning to breastfeed, the infant is breastfeeding well, the mother's nipples are not sore, and the infant is few months old. What do you think would be the answer?
It is D.
Okay. Baby-led latching. So we are talking
The
about
infant
something
is
called...
breastfeeding well. B.
Okay.
Option D.
Okay. Option D, you said, right?
Yes, ma'am.
Okay. Okay. So, before looking at the answer, baby-led latching, it is an instinctive breastfeeding by the baby, um, where the baby knows where the breast is, and the baby is trying to initiate the breastfeeding, and the mother is at a laid back position, right? So here, if we consider our options, say the infant is learning to breastfeed, or the infant is breastfeeding well, the mother's nipples are not sore, and the infant is few months old. So let us look at the answer. So the answer to this is the infant is learning to breastfeed. So you people have said option B and D, right? So if the infant is breastfeeding well, that means the breastfeeding technique, the traditional or the conventional breastfeeding technique, has been established well with the baby already. And that is the reason why the infant is already breastfeeding well. Number two, the mother's nipples are not sore, right? So if the mother's nipples are sore, that means a proper breastfeeding is not being effective, in effect, right? So if the mother's nipples are sore, so that means she's facing some discomfort and proper breastfeeding is not being happening. So that can also be mitigated with the help of baby-led latching. And if the infant is few months old, so if the infant is few months old, so that it can be assumed that okay, that the baby has now learned how to get a proper latching and how to get the maximal effect of the breastfeeding, right? So these three options, the infant is breastfeeding well, the mother's nipples are not sore, and the infant is few months old, it automatically gets eliminated. So the first option, the infant is learning to breastfeed. So as I said, that baby led latching is a very instinctive phenomenon. So when the baby is very young and the baby is just starting to know the breastfeeding phenomenon, so that is when this baby led latching comes handy. So the answer to this question is the infant is learning to breastfeed. This can also be useful if the if the baby is not being able to breastfeed properly in spite of repeated efforts. So this position can also help in case of these babies where breastfeeding is not being properly carried out. So we'll move on to our next question. Which position is considered ideal? Which position is considered ideal? Okay,
Near to nipple. Ma'am, A.
okay,
Yeah, ma'am.
correct. So, near to nipple. So is this should be kept in mind that the near to nipple or the nose to nipple is the ideal position for the baby during the breastfeeding technique, right? So whenever we are talking about the specific placement of the baby's mouth onto the mother's breast, so it is the nipple and the lower part of the areola which should be into the baby's mouth. And this placement can be guaranteed when the baby is kept in the proper position, and it is the nair or the nose which should be at the level or slightly above the level of the nipple. So if we look at the options, chin to nipple, forehead to nipple, lips to nipple. So obviously chin to nipple doesn't make sense because as we have discussed, to have a proper positioning of the baby during breastfeeding, the chins should be resting on the breast. And the forehead to nipple, obviously no. Lips to, if it is lips to nipple, then it will culminate into nipple feeding, which obviously is undesirable and we don't want that. So definitely the answer to this question is near to nipple. We'll move on to our next question. How wide should the baby open its mouth before the mother puts the breast in it? 30 to 60 degrees?
90 to 120 degrees.
Okay.
Option C.
Okay. So we have divided opinions between option C and option D. So people who are saying option C.
Option is A. D.
It is option D.
120 to 160.
Okay. Okay. So people who are saying option D, can anybody tell me why do you think it is option D?
It talks about the child should open mouth wide open more than 120 degrees. So we thought it is 120 to 160.
Right. So whenever we are talking about the mouth opening of the child, so the most desirable is a wide opening, right? So the wide opening of the mouth can be guaranteed, as we know that it should be a minimum of 120 degrees. So whenever we are considering this angulation of the mouth of the child, so we have to see the angle between the lower lip and the upper lip of the child. So if we consider this, say for suppose we have a very small opening, so it is at an acute angle less than 90 degree. So of course it is not possible that the child is able to grasp the desired area of the breast with the small mouth opening. If it is 90 degree, even if it's 90 degree, it is not a proper angulation for a proper latching onto the breast. So the ideal would be 120 degree. But also if it's more than 120 degree, it is also helpful for a proper latching. So, say for suppose we have the lower lip and the upper lip at this angle, right? So this is a 90 degree. So once we have a wide opening, so say for suppose we are now going towards obtuse angle, so this is around say for suppose 120. So this is a wide mouth opening for the child, which will ensure that which will ensure that the child is able to encircle the proper or encircle the adequate amount of breast tissue that is required for latching properly, right? So the answer to this question is 120 to 160 degrees. Please do not get confused with the numbers. Keep in mind that it is the wide opening of the mouth of the baby that is more important for proper latching. So the angulation between the upper lip and the lower lip should be a minimum of 120 degree, and if it is more, it might happen that the angulation becomes more in case of some children. So that depends on the anatomy of their structure, but obviously it should be 120 or more to ensure a proper wide opening of mouth. Okay, I hope I'm clear.
Yes, ma'am.
Yes, ma'am.
Okay, so the answer is 120 to 160 degrees. So this was the last problem for today's session. Does anybody have any questions? Okay. Okay, so some of you had some queries listed in the portal. I have tried to incorporate those, I've tried to address those queries also through the problems. I hope you people have been able to get the answers to your queries. In case you still have doubts, you can always come up with the doubts. Anybody has any other questions?
Ma'am,
No,
I
ma'am,
have a
actually-
question. Ma'am, I couldn't do first 5 assignments because I was not too well.
Okay.
So should I try doing them first before I do the 6th assignment? Because the due date for 6th assignment is tomorrow. Like I'm supposed to submit it by tomorrow. So should I begin with the first assignment even though the due date is over? Will it be like
See, the thing is, since the due date is over, so I don't think so whether that will be considered or not, because that is a decision which is strictly taken by the course instructor and the NPTEL team. But obviously, regarding the scores which are to be considered, it will be from the best 8 assignments. So since you are saying you have already missed 5, so I think it would be better if you reach out to the NPTEL team, or you can put this as a question to Dr. Rupal Dalal also.
I have got a question. Last 20th question of the thing was, why should the mother keep her back straight in cross cradle hold?
Yes.
The options were to prevent the back pain, to decrease the milk flow, to increase the milk flow, and to feed more hind milk.
Okay. So the posture, the straight posture of the mother, it is more basically related to the reducing the incidences of back pain for the mother. So making the posture more beneficial for the mother. So that is the I think that should be the answer to your question. I think option 1, right?
Yes, right. Option 1.
Yeah, that should be the answer.
Thank you.
Yeah, thank you. Anybody else has any questions?
can you please once again explain how do I reach out to NPTEL people? How do I write my query?
There is a ask a question tab when you go to the portal. So you can just, the place where you
Okay.
actually put your queries. So you can put your question there also. Because, even if you complete your rest of the 6 assignments now, you still have to have 2 more assignments since they consider 8 best assignments. So you can put your query there.
Okay. So we'll have 12 assignments now in all?
Yes.
For 12 weeks, I have 12 assignments?
Yes, 12
Okay,
assignments.
so that means even if I begin with the 6th assignment, so I'll have 6, 7, 8, 9, 10, 11, 12. 7 more assignments I can do now?
Yeah. And then you'll have the examination, of course.
Okay. Yes, ma'am. Yeah. So what I'll do is I'll do the 6th assignment and I'll also put up my query. And if they agree that I can do it, then I'll begin with the first assignment again.
Yes,
Can
you
do
can
that?
you can put that query, and yeah, I think it's better to get the clarification from Dr. Dalal directly, because she'll be handling the assignments and scores and all of that. So yeah,
Okay, ma'am. Thank you, ma'am.
thank you. So do we have any more questions for today?
From my side, I don't have any questions.
Sorry.
I'm clear. From my side, I don't have any queries. It's clear.
Okay. Thank you for saying that.
Thank you very much, ma'am, because there is a disturbance here. Actually, I put my 2 queries in this, and the 2 are answered, ma'am. Thank you so much.
Okay. So I'm assuming the queries related to the breastfeeding topics, they have been addressed, and please go through the previous sessions as well, because ultimately you will be having a cumulative assessment of all the topics. So yeah, that is all regarding this, and we'll meet again next Tuesday at 7 p.m. for the discussion on week 7. And happy Holi to all of you again. Okay.
Thank you. Happy Holi to all.
Okay.
And happy Women's Day to all the women around there.
Yes.
In advance.
In advance. Happy Women's Day to you people as well in advance.
Thank you.
Okay. Thank you.
Thank you, ma'am. Happy Thank you, ma'am.
Thank you, ma'am. Thank you.
Bye.
Bye. Thank you.